Good morning, everybody. My name's Eve Roothouse. I'm the Chief Officer for Culture and Economy at Leeds City Council. Thank you very much for joining us this morning. I'm delighted that working with Nick Fox, we're bringing to you this morning a digital breakfast with NHS Digital. I'm really grateful to the Chief Executive of NHS Digital, Sarah Wilkinson, for taking the time to join us, as well as Nick and his team for all the work that's gone into the preparation of this, and the partners that are joining us too. We're really proud to have NHS Digital based here in Leeds and to have you as one of our anchor institutions, and we're looking forward to hearing from you this morning. So unfortunately, we started a little late because we had a few technical hitches in getting our Chief Executive from the Council, Tom, joining us. Hopefully he'll be able to join us later on. So what we're going to do is move straight into an introduction to NHS Digital, for which I'm going to hand over to Sarah. So good morning, Sarah, and over to you.
Thank you, Eve, and thank you very much to everybody who's joined us online today. And just to reiterate what Eve said, thank you very much to Eve and to Nick for working together to set this up. Tom and I had the idea of this session when we were working together in the happy days of test and trace last summer. It's amazing what thoughts come to you in a long evening of looking at test data. And we were talking about working together in Leeds and how we really don't maximise the opportunity. So Tom sort of said, well, let's do more, and the result of that hopefully is kind of us doing more, starting with a session today. So we do a huge amount of our business in Leeds. Nick will go through the figures. Leeds is an absolutely fantastic city. I've spent a huge amount of my life in the city in the last few decades. My husband was born and bred in Horsforth. And we're very, very proud to call it our home. We really love it. We really love the fact that we're growing in Leeds and we're doing more and more business in Leeds all the time. We really want to continue to strengthen our ties to the city. We want to work with all the other digital organisations based in Leeds to strengthen the community overall. I mean, I think it would be absolutely fantastic to work together to make Leeds the most vibrant digital community in the country. And the way we can do that is by really increasing the business that we do locally, better understanding each other's needs, supporting each other's growth in the region in whatever way we can, working together to attract great talent to the city, and that's from the graduates. We want to bring in a lot of graduates this year, right up to most senior staff. Working together to develop our talent and share knowledge and experience between organisations. Working together on those sort of matters where we have a real common interest. That could be pretty much anything from local investment to legislation, and just generally doing everything we can to boost each other's brands. So that's what we hope that this relationship can build into. And really all we wanted to do today was to start by telling you a bit more about us, and getting to know you guys hopefully over another series of conversations which we hope will follow. Now, in some cases, we know you quite well and you know us quite well. Some of the people in the audience have been working with us for a long time. So I'm going to start by telling you a little bit about NHS Digital, and recognising that for some of you this will be not terribly exciting because you know a lot of it. But please bear with me, because obviously we're trying to sort of build our understanding among a broader set of people who perhaps don't know what we do very well. So NHS Digital basically is the big national technology and data organisation within the NHS. We've got about 3,000 staff. We work really closely with lots of other organisations. What we do is we design, build, deploy and operate big national technology systems for the NHS. So fundamentally, as an organisation, we're engineers, computer scientists, mathematicians. And our purpose, our absolute mission, is to improve the health and care system in the UK. I know that most of you who are joining us this morning are from digital provider organisations, which is absolutely fantastic. At a very simple level, we think of ourselves as doing four things. The first is we design and build digital products. The second is we collect, curate, analyse the enormous and extraordinary amount of data that floats around in the NHS. The third thing is that we build national platforms and infrastructure that all the parts of the NHS need to operate. And the fourth big thing we do is we run all these systems every day to an extraordinary level of reliability. Actually, we managed to achieve 5 nines on most of our critical systems, and obviously with a huge focus on cybersecurity. And so I think the best way to give you a sense of what this work is really like, rather than being too academic about it, is just to tell you about some of the projects we've done during COVID. So I will tell you a couple of them. I'll hand over to Jonathan, who is our Chief Medical Officer, who's been heavily involved in many of them, and he will tell you about a few more. And hopefully that between us will just give you a bit of a sense of what we do as an organisation and how we've responded to the pandemic, which has been totally and completely consuming for the past year, as you can probably imagine. So let me start by just talking a little bit about data. The NHS dataset is unquestionably one of the most extraordinary datasets in the world. Unlike almost all other countries, what we have within one system is the entire medical records of 67 million people. We know when they were born, we know when they die, we know every interaction they've had with the health system during their life, every GP appointment, every hospital appointment, every procedure, every surgical intervention, every blood test, x-ray, ultrasound, every medicine they've been prescribed, every vaccination they've been given, every allergy they've had, every diagnosis they've been given. Now, of course, in other countries, you look at the US, for example, that data is held in lots of separate private sector systems. There is no national view. And in fact, if anybody's ever worked in the US, it's extraordinarily difficult to get your own medical records moved from one provider to another. So we have this extraordinary and internationally unique set of data. And it's a set of data that is of incredible value to medical research. And one of the things we focused on really hard in the last 9 months is working really tightly with medical research teams and clinical trialists to get that data to them. We provided the data support for the recovery trial. That, you'll remember, was the trial that initially proved that Trump wasn't quite right about hydroxychloroquine, and then I think in probably the most impactful clinical drug trial finding thus far, proved that dexamethasone had a hugely positive impact on COVID-19 patients who were on oxygen or on a ventilator. So it's a real privilege to be involved in those kind of pieces of work. We've also done an awful lot of work during COVID, relating to sort of understanding the progression of the virus. We could see from sort of the calls that were coming into 111 and 999 and all the activity on the 111 online system, which we run, that what symptoms people have been exhibiting through the course of the last year, and how serious those symptoms are, and where those people are geographically. And we can see from testing system data flows who's being tested where and what the rate of positive tests are. We can see who's being admitted to hospital in intensive care and what their clinical history is. And of course now we can see who's being vaccinated and what the rate of success of the fantastic vaccination programme is. We've done lots of work to visualise this data, and it's great having Alistair here this morning. He's going to talk us through some of the dashboards that his group have created, actually under Tom's direction last year, to create better information for the public and for public health professionals and internal NHS professionals about how about rate of infections and various other things. I won't go into that because Alistair will, I'm sure, talk us all through it. We've done, lots of other fantastic things with data. We did some work in the summer last year using some ML models which had been developed by a team that we're partnering with at Cambridge University called the Cambridge Adjutorium. There's a group that's really just focused on medtech, and we built some of the deep learning models that they had created that were predictive models, and we applied them to understand ventilator and ICU bed utilisation, to build predictive models for that. And those predictive systems are in trusts across the country, and the help that we provided has been critical. The feedback we've got from the hospitals that took those services have been very positive, and importantly the back testing, if you like, of the data has proved to be quite reliable. I suppose no sort of mention of data is complete without talking about some of the information governance challenges as well. So obviously managing this data is a really complicated challenge. Whilst it is this extraordinary data set, as I say, which can tell us so much about disease in general and about how best to care for individual patients and how to manage the NHS and so many other things. But of course, it is also extraordinarily sensitive. So research shows pretty clearly that there is no other data that's more confidential and where privacy is more precious to people. So we have to be extremely careful how we handle it. We have to make use of a very broad suite of privacy enhancing technologies to encrypt or disguise the data, so that in identifying individuals is absolutely critical for a given use. We use the data in anonymized or somewhat anonymized form. And anonymity itself is obviously a complex business. So there's a huge amount of work we do in the technical side of protecting and managing confidential data, but also in the way in which we work to build public confidence in the way in which data is used, by ensuring that we're completely transparent and open about exactly how data is used and the legalities of that and the purposes for which it's deployed. I'm just checking the time, and we've done a huge amount of work this year building lots of new products and services for the NHS. What I'm going to do actually is let Jonathan talk about those, and then if we've got a bit more time at the end, we can come back and I can happily take as many questions as anybody has, and go into a bit more detail on any specific products that people are interested in. But what I'll do, I'll pause, I'll let Jonathan pick up on a couple more projects, and we can go from there. Jonathan, over to you.
Thank you very much, Sarah, and good morning, everybody. My name is Jonathan Benger. I'm the Interim Chief Medical Officer for NHS Digital, and also a practicing emergency and pre-hospital clinician. As Sarah said, we employ about 3,000 people, and between 70 and 80 of those are fully registered healthcare professionals, and my job is to lead that team and the wider clinical engagement within NHS Digital and with all of our external stakeholders in order to ensure that our products and services are as effective and relevant as they possibly can be for patients, citizens and the staff that use them. I think one of the positive sides of the pandemic has been the ability to develop those relationships further, and really work closely with clinicians to ensure that we deliver the services that they need and that patients require during the pandemic. And as a result of that, a wide number of additional services have become much more prominent, I think, and much more effective in terms of meeting the public's needs. And those digital services, I think probably the flagship is NHS.uk, which was already a very large undertaking, has 40,000 pages. It's the 10th largest website in Europe. But NHS UK has become the trusted source of information for the public during a very challenging time, when obviously people are looking for information around coronavirus. They're looking for reliable, accurate and trustworthy information. For us as an organisation, when the Prime Minister stands up on a podium with a lectern that says NHS.uk/coronavirus, we know that our products are right in the centre of the response. Whilst the pandemic has obviously been a hugely challenging time, it's also been a time when in NHS Digital we've been proud to step up and meet that challenge. And certainly our web services have become even more integrated and fundamental to healthcare delivery in this country and indeed internationally, because we get an awful lot of international traffic from other countries who see the NHS as being a source of honest, unbiased and trustworthy advice. And then alongside that, as Sarah has already alluded to, the NHS Pathways product, which powers NHS 111, the telephony service. So all 111 providers throughout the country, about 16 million 111 calls a year are powered by NHS Pathways, as well as half of the ambulance services in England who use Pathways for their 999 calls. And obviously there's been a huge increase in volume, and we've been working very hard to adapt our algorithms and pathways as fast as possible to keep up with the very latest advice. And on some occasions in the early stages of the pandemic, we were changing the pathways algorithm up to twice or even 3 times in a single day in order to keep pace with the evolving and developing pandemic. And our teams have shown flexibility in achieving that, and ensuring that, again, the public get the very latest advice and that clinicians know how best to support them. The NHS Pathways product is also available online through NHS 111 online, and that has certainly become the go-to place for healthcare advice. And so what the pandemic has done inadvertently but effectively is it's accelerated a long-term strategic ambition for the public to use online services and remote services as an effective way of accessing healthcare. And so what would have perhaps taken a decade to achieve has been achieved in a much shorter space of time, and has built the infrastructure and the sense of trustworthiness of those products, so that people now use 111 and 111 online and NHS UK as their first port of call to access to healthcare. And we've seen that in our figures, in the uses of those services, and an effective development of all of these products in a way that the public now recognise that these are the first places to go to for digital care wherever possible, whilst ensuring that we also maintain alternative channels for those who are unable to access digital technologies as the first line of access. And obviously it's important that we serve the whole population and not just those who are immediately digitally literate. We've also developed the 111 service to allow bookings into, particularly into emergency departments, although the system that we built has additional flexibility to book into other areas of the system. And the really important thing there has been able to use 111 as a way of triaging demand and ensuring it's directed to the right place first time, so that people get the services that they need directly and without having to consult multiple providers. And that's proved very effective in managing demand in emergency departments, and also starting to create a flow of patients so that patients aren't queuing or backed up in emergency departments in a way that could spread coronavirus. And so we've launched that as a national service towards the end of last year. And that's proved to be a hugely effective product that allows people to book directly into emergency departments through 111 services, both through telephony and online, and therefore access care in a timely and effective way. We've also supported a wide range of other projects. You may have seen in the press recently a project in relation to measuring oxygen saturations for patients who have coronavirus at home. The COVID Oximetry at Home project is a project to ensure that people who have coronavirus are carefully monitored, particularly those in higher risk groups, so that any signs of early deterioration can be detected through oximetry, and those patients can be assessed and, if necessary, admitted in a more timely way. Drawing on the routine data that we have collected through NHS Digital, we were able to identify that a delay in hospital admissions for patients with coronavirus was associated with an increase in mortality. And our clinicians were telling us that patients were presenting later than they had expected, and that made them harder to treat and prolonged their length of hospital stay and potentially led to some avoidable deaths. And so the COVID Oximetry at Home programme is based on data collected and analysed through NHS Digital, and also being delivered with the support of NHS Digital, working closely in partnership with NHSX and NHS England to ensure that patients who have coronavirus but are currently well are also closely monitored and supported at home to recognise deterioration and admit in a timely way. And that's proved extremely effective. 300,000 oximeters have been distributed, and this provides support and reassurance to people in the community, and will be a model that we will build on further to provide remote monitoring services and support the data collection that sits behind that, so that we have a joined up healthcare record, as Sarah has already described. And I think, as Sarah has already outlined, our work in data and data sharing has been extremely effective in underpinning research and the overall response. It's the data platforms that sit behind Test and Trace, behind the vaccination programme, and at the moment many of our staff and our clinicians are extremely busy supporting the required data flows to ensure that each vaccination is correctly recorded, so that we know who has been vaccinated, where and when, and with which exact batch and dose of vaccine. And as you know, we're now approaching up to 500,000 vaccinations a day. That programme is increasing with real pace, and keeping track of that and keeping up with that is an ongoing challenge for us. So I think it's fair to say that what the pandemic has done is accelerated many of the areas that we had always had an ambition to improve upon, and has really cemented for everybody in the country the role of digital healthcare and digital delivery. So what I want to do now is look at a little bit more detail at some of the dashboards and some of the information that we have collected and that we are able to present with a particular focus on Leeds, because that's where most of our staff and most of our clinicians are based. And so I'm going to hand over to Alistair, who's going to go through some of those dashboards with you today. Thank you.
Thanks, Jonathan, and hi everyone. Hi, I'm Alistair Ward. I look after a lot of our dashboards at NHS Digital, and I think over the last sort of year or so, I've only been here a year and a half, we've really sort of built really sort of solid capability. Really spurred into action by the COVID response. So what I want to do now is just walk through some of the stuff we've got in the public domain. I'll touch on some of the stuff we've got in the private domain, but I'm not going to show it for sort of obvious reasons, and sort of show some of the stuff we've done, but also how we can use some of these national data sets for a local purpose. So I'm a Leeds resident. I live in sunny Cookridge, so I'll just show how we can show some of that information so it's relevant to the public and also directed to public health and other health professionals. So I'm just going to kick off a screen share. It's always better to show rather than talk. So let me know when that's coming through. Okay, so hopefully you can see my web page, see Google coming up. So you can see I've NHS dashboards, just type it in on the top of Google now, and you'll go to our dashboard hub. So this is built entirely in response to COVID and taking a sort of a number of data sets that we felt really pertinent, bringing those together into a dashboard, so releasing the open data, but also making sure there's a dashboard there so people can easily consume it, be that a member of the public, a data journalist, a researcher, a whole range of personas. There's quite a few dashboards, as you can see, that we've built up over the last few months, all sort of relating to different aspects of the virus. So NHS pathways, as Jonathan was mentioning about, so a lot of that aggregate data is in the public domain. Shielded patient list, so understanding sort of vulnerable people and where they live in and around England, as well as progress on people volunteering for their vaccine studies, and also we've got a private cohort selection tool, which I think is really quite cool in a geeky way behind the scenes to enable researchers find the people they need to do trials, which is I think incredibly worthwhile, especially at the moment. So coronavirus in your area, that's our most recent dashboard released November, just before Christmas. It's going to give an idea of what that looks like. So you can just select any of our dashboards on our hub, and it'll drop you into here. And this is all driven by postcode. So I'm going to put LS16AE, just happens to be our head office in the centre of Leeds. I haven't seen it as much as I'd like to in the last year, but there we go. And what this is going to do is going to bring up sort of an overview of COVID cases and 111 calls and triages associated with COVID. Okay, so immediately it brings up a little map. I can see a little pin in the corner in the middle, which is this postcode, and I can see that in a 7-day period up until the 20th, there's 19 cases in this area in the centre of Leeds, and then I can compare that to other areas in Leeds around me, and I can hover my mouse and see, well, okay, in Holbeck they've had slightly more, so 35 cases in that period, and equally I can scroll down and look at the sort of the triages. These are people phoning up with suspected COVID, and in the early days of the pandemic it was quite interesting. That was quite a lead indicator, less so now, because obviously with adoption of mass testing. So again, sort of just brings together some key information, a load of national data sets being clunched together in the back end and presenting this in a way that's much more consumable. It was quite interesting. So there's open data sets around this have been open for a while, but within this dashboard going live, we had about 2 million hits in about 7 weeks or something. And we've got a community of sort of 30,000 people that are coming back every day to look at this and consuming it and getting some value from it, which I think is a great story about data transparency, and also using technology for the public good. And I guess from a Leeds perspective, not only my Leeds resident, the vast majority of the team that built this dashboard we worked very closely with our Logic and some other folks to build this. We're all Leeds based, so yeah, mostly built in Yorkshire, which is always good. Just thing to touch on here, so if you want to look at wider areas, wider geography, I could say, okay, I'm interested in something 6 miles out, and then you can click and drill. Just choose up here, just happens to be where my boss lives, and I can start to see areas in that specific area. So here we go. So I can see Bramley, and start to see the trend in cases and 111 triages. So I'd encourage people to have a look, click around. We always try to make the data available. Obviously, you've got suppression rules, things to take into account from data protection, but here's the raw data that you will be able to download and can explore at your leisure. So again, hopefully fueling that sort of transparency agenda. There's a whole range of dashboards on our public dashboard hub. Mainly focused on stuff to do with the pandemic. Again, most of it built in Leeds, and really interested to get feedback as ever. And I think one thing I would say is this is the public face, so this is like the tip of the iceberg. There's also a private hub that's been taking information and pumping that out to a range of sort of users to support the pandemic. So most popular products probably are Pillar 2 Contain, which is a lot of jargon, but it's basically testing data in the community and helping directors of public health understand the outbreak in their local area. So it's like think of it as a fancy mapping tool where you can say, okay, I'm in Leeds, and you can drill all the way down to postcode to see where cases, tests, 111, 999 calls are, and that's probably one of our most popular products in our private side. I've always touched on that sort of that researcher tool that we built for cohort selection. So that's been in beta for the last few weeks and is going live now. Last week we went live with a dashboard to help universities sort of track students who will be coming back, some already coming back for certain courses, and those test results and positivity rates. So some people managing those test centres on university campuses can see what's going on, which again was a great project to be involved in. And then we've also got a range of sort of non-COVID projects that are built on the capability that we've built over the last year, which I think is really cool, because I think this is building something for the long run here, not just to support COVID. So I think so looking at supporting stuff around GP appointments, you're supporting new cervical screening sort of program that's been kicked off, and how we can use a lot of this technology and teams to support that, which I think is really fantastic. And then if you scroll down to the bottom of the dashboard here, you can start to see that we've started linking through to maternity services and some other I think quite useful dashboards that more relate to sort of not non-COVID topics, but using a lot of the capabilities that we built in response to COVID. So I think, as I said, I've been in the NHS a year and a half. It's been a fantastic time to join in many ways, albeit rather hectic. And I think what we're seeing is that sort of digital transformation just moving at a massive pace, really. Yeah, I suspect this hub will continue growing over the next year, which will be fantastic. So if anyone's got any questions, let me know, ping me on LinkedIn, an email, don't mind. I'm happy to talk, really. So that's me. So I'll hand over to Nick.
Thank you, Alistair. Really good to see. So I'm just going to share a couple of slides. So hopefully you can see that. So morning, everyone. I'm Nick Fox. I'm Chief Commercial Officer at NHS Digital. I live likewise in Leeds and have worked here nearly all of my professional life, and it's great to be here with everyone this morning, and I guess share some of the successes of the Leeds sort of health tech digital sector. So Sarah and Jonathan Alistair, as you've heard, have talked about some of the work that we do as an organisation in support of citizens and the health and care system. And I just wanted to extend that in terms of how we work in partnership with industry and with Leeds as a city. So I think the first thing to say is that there's almost nothing that we do that we don't do in partnership with industry in one form or another. And many of the partners that we work with, are Leeds based, either wholly Leeds based, or have got significant presence in the city. As Sarah and Jonathan were saying, we're a Leeds-based organisation from a head office perspective, and the majority of our staff are based here in Leeds. And over the last financial year, about 40% of our total spend was with suppliers that are based in Leeds and have got a presence, or a big presence in Leeds. And we really value building strong partnerships with our key suppliers and with our partners. And on this slide you can just see some of the partners that we work with a lot, who are based predominantly in Leeds. And in a minute, Stuart from Bgss is going to speak to you just to give his perspective of what it's like to work with us and their contribution to the city. We also work closely with Tech UK as an industry body that I suspect many of you are associated with, and they've got their own specific health tech council and focus. So as well as direct spend and partnerships that we have with tech suppliers in Leeds, we also manage significant spend and significant work for the wider health and care system. And in particular, just wanted to touch on something called the Digital Care Services Framework. And this is a framework and a vehicle that provides clinical systems for use in primary care. And I think it's worth remembering when we talk about Leeds and digital health tech, remembering that 97% of all GP practices have their clinical systems provided by either EMIS or TPP. So that's a pretty amazing statistic, and we've got all that capability sitting just up the road from where I am in Horsforth and in Rawdon. And Sarah spoke earlier about some of the work that we've done, as did Jonathan, in response to COVID. The work of TPP and EMIS and many of our Leeds-based partners has just been absolutely amazing in terms of the support that you've given to frontline health and care staff, and I just wanted to thank all of you and all of the partners that we work with for all your incredible work over the past year, in particular in supporting the nation. And then just in terms of sort of a contribution to the Leeds-based economy, between the direct spend that we manage and through the spend through the Digital Care Services Framework, about £200 million a year goes into the Leeds-based digital health tech economy. So quite a significant amount of spend. We want to continue to build really strong partnerships with suppliers and with industry in Leeds, and we want to make it as easy as possible for you to work with us. Alistair touched on some of the dashboards. There's also a technology suppliers section on our website, so you can find out about opportunities, how to get in contact with us. And we also publish a pipeline of future upcoming procurements. So details that are on there, but pretty easy to find. I also just wanted to mention a new framework that we've just put in place with Crown Commercial Services. It's called the Digital Capability for Health Framework. And going forward, this will be our first port of call for where we go for digital capability to partner with us. And whilst there are now 12 prime suppliers on that framework, we really encourage suppliers to partner with smaller SME organisations through their subcontract routes, to provide additional capability and capacity through those arrangements and through that framework. So if you're a smaller SME, we can also help with discussions around potential partnering opportunities. So finally, just before I hand over to Stuart, so as well as partnering with industry and with many of you on the call that are joining us this morning, we also want to be a great partner to the city. So along with the council, led by Tom and Eve, who's with us this morning, and a number of the other big Leeds institutions such as the universities and colleges and hospitals, we're one of the Leeds anchor organisations, and we really want to continue to contribute more broadly to the city as one of the major public sector employers. So I'm now going to hand over to Stuart from Bgss to get his perspective of working with us in the city, and then I'm going to hand back over to Eve, and I think Tom has now thankfully joined us to offer his reflections. So Stuart, I know, apologies, there was also a couple of challenges with you joining this morning, but I think you're with us now. So I'm going to hand over to Stuart. Thank you, everyone.
I am. Can you see me?
We can hear you.
Ah, but you can't see me.
Not at the moment, no. Ah, no. Yes, we can see you. Fantastic.
Is that better?
It was for a second. Yes, there we go.
There we go.
Morning.
Hi. Morning. If I share my screen, can you see that?
it's just coming up. Yeah. Perfect.
Perfect. Right. Thanks for that intro, Nick. I've got a bit of an echo, but I'll just keep going. So Nick's asked me just to tell you a little bit about what it's like to work with NHSD in the Leeds sector. So just got a couple of quick slides, just so by way of intro and context. I'm Stuart. I'm the Managing Director of Bgss. We deliver technology solutions used by millions of people every day. There's about 1,500 of us across the UK, USA, Europe and Australia, across 15 offices, 10 of those in the UK. Although proudly Leeds based, we've been in Leeds for 28 years and our head office there, and over 450 of those people are based out of our Leeds office. We basically have 6 tightly integrated services, all focused on delivering digital transformation from strategy, design, tech and engineering, cloud and platform managed service, and data and AI, all underpinned by our Queen's award-winning enterprise agile approach. We simply achieve this by being truly Yorkshire straightforward to deal with and nurturing talented people. And you can see from the bottom left on the slide, we have to that end we have an academy. And this year we'll have put 75 students through that academy, ranging from apprentices, undergraduates, graduates, retrainers and returners. We intend to grow that, and our plan for next year is that will be more like 120 people. So working with NHSD then, we've been partners with NHSD for some 9 years now, collaboratively working to deliver a variety of projects. Together we've worked on engagements across all of those services that I mentioned earlier on. And some examples are there on the top right, the type of things we've done. So we're working together to replace 20-year-old legacy systems, rebuilding NHS infrastructure technology, contributing to the paperless NHS, reducing the frontline workload, and obviously latterly working really together hard to work to beat COVID-19. And our staff are really excited to work with NHSD. I think it gives us a strong moral and ethical joint working relationship, which has been fantastic for us. And we're really excited and looking forward to the future. And it would be remiss of me not to mention our relationship with Leeds City Council. We've been in the community for 28 years. We work really hard with Leeds Council, and they create a lot of opportunities for us to work together. Things like some of the ones I've mentioned in the bottom right hand side there. So Leeds Outbreak Control Board during this COVID time, Digital Skills Partnership, Digital Steering Group, Learning Alliance, Inclusive Growth and more. They're also very approachable when if we're looking for employment initiatives. So engaging with the council to talk about how we can engage together to improve employment for the disadvantaged. And I think the council have been fantastic in working with us to build our team. And then it would be remiss of me not to mention some of the other contribution that Leeds has made to the digital map. And from our Leeds office, we deliver some impressive digital services into all these sectors: financial services, retail, energy, and public services. And then finally, just to mention that a lot of this work in the cloud helped us win the AWS Public Sector Partner of the Year in 2019. So that was the intro from me, really. I guess all I would do is urge for other digital partners kind of in Leeds to engage with NHSD. As Nick says, I think that the framework they put in place allows us to engage and work together, working with NHSD to deliver some quite impressive services, and I think also some interesting technology that really puts Leeds on the map. And I guess the one thing I would probably say about that entire relationship is the collaborative nature of those engagements. So many of you on this call will have worked with us and will have worked with you on delivering those NHSD services, and it's a fantastic opportunity to do some exciting digital work. That's it from me. Thank you very much. You take that back.
Thanks, Stuart and Nick. I think we have managed to overcome the technology challenges to some degree, and we have got Tom via audio. So Tom's just going to say a few words of reflection.
Thanks, Eve, and thanks everyone. Sorry, you can't see me. It's probably a blessing in disguise, but it's great to hear the you know, the range of different perspectives, starting with Sarah and going through the, you know, the tech and health ecosystem of the city. There is such a versatile, a deep and a talented pool of companies and organisations in Leeds around this agenda, and I think just having a look, if you have a look down the, you know, who's on the call, it's like a bit of a who's who of health tech in you know, in the UK. And when we did the piece of work with Boston University, MIT Boston, and did some work to look at our economy and our innovation ecosystem in Leeds and sort of compare it with, you know, previous studies on Silicon Valley and other things. We did it with Sydney and Oslo and some other countries, cities around the world in the last couple of years. What came out, not surprisingly, was that this sector is absolutely at the heart of our competitive advantage as a city and as a region. And when you test it against the best in the world, it stands up really well. And the combination of having the NHS based in the city, together with such a growing and versatile tech sector, provides a tremendous opportunity, not just in UK terms, but in global terms as well. And I guess having done that piece of work, that has come to life a bit in the last year, unfortunately, given the pandemic. But as you've heard, you know, that has transformed the way that we think about and provide and analyse and make decisions about healthcare and, you know, government policy response based on the data that is provided out of Leeds and based out of the expertise that we can develop. So just personal examples, I was in the summer involved with Sarah in developing the basis of the testing approach that rolled out, and I was involved in the original work on the Contain framework nationally. And what became clear there was that we had a lot of work to do to join up the various data sets in a way that didn't compromise obviously the big issues around personal data. But we've managed to do that, and the dashboards that you saw this morning have become part of my everyday life. So I've already logged on this morning, as I always do, as every local authority chief exec will do, to the NHSD dashboard. We've all become very obsessed with the case number and the triage numbers that you've seen. So I can tell you in the next 3 or 4 days, the Leeds figures will be about 279 cases, and our triage is going up a little bit. The percentage of the variant that's in Leeds, unfortunately, is one of the highest in Yorkshire, at about 3/4 of the cases now. So we know all of this because of the joint work that now takes place between PHE, NHSD, the NHS and the council. And I think the other thing that's happened is when I want to get a sort of minor medication that I use, I now do it through the TPP site, and I get it online and ordered through the post through Pharmacy for You. So, you know, the sort of, I'm a little microcosm of how a lot of things have changed for people, and actually there is a potential transformation in the way that we think about public health and we think about our own health in maybe in a different way as we come out of the pandemic, which, you know, all of you as organisations will be intrinsically involved with. So I think this whole agenda is not just important for Leeds, it's important for the UK, actually in the world. It's not overstating it to say that. The work that we're doing to follow on from MIT is to try and expand our ecosystem, make it easier for people like yourselves to engage with that sort of process. So we've got University of Leeds colleagues, Eric is on the call, and there's some great spin outs coming out of the work that they're doing. And what we're going to try and do is get a much more singular approach with sectors in terms of engaging on action-based approaches. And one that we're doing at the moment is with the legal sector, where we've got what's a quite a traditional sector to think about tech in a different way, and we're going to be doing some societal challenge work with them to look at a challenge approach where we can get smaller and bigger corporates working together with the with the academic base in the city to look at how we solve some of these big problems in the next few years. And we want to do the same with yourselves as well, and continue that work in a way that will really, I think, sort of turbocharge all that you've heard this morning, and make sure that Leeds, expands even more. It is such a challenging time at the moment, but there are so many good things going on in the city I could talk about. I don't have time this morning, but lots of interest in that. You'll have heard the DLA. I think DLA are on the call this morning. DLA's decision about the new office space in City Square. We've got the Majestic, Channel 4 opening this year formally. We've got announcements of investment into the South Bank this week, and I'm expecting another work to start on another major development site in the city next week. So, the interest in Leeds has never been greater. We've got interest from some of the most senior government departments. Some of the best companies in the world are now making inquiries, and I think, despite the massive challenge that we're under at the moment, the fundamentals of Leeds are really good, and we want to just continue collaborating, continuing working with all of you. And thank you. I'll finish by just saying a big thank you to Sarah and the team at NHS Digital for what they've done in the pandemic, and all of you as well for the way that you've come together and helped us in the city. So I'll leave it there, but thank you. Sorry you haven't been able to see me, but really interesting morning, and thanks very much for bringing this together, Sarah.
Tom, that's a very strange experience, because while you were talking, my image was showing. So it's a shame I'm not a good mime artist. Otherwise, that could have been quite entertaining. So thank you very much for persevering, Tom, and sharing those reflections with everybody. We've just got a few minutes left, so I was going to just ask a couple of quick questions, because there was a couple of comments from colleagues at Leeds University, particularly in relation to the Leeds Institute for Data Analytics. So I just wondered whether one of our NHS Digital colleagues might just say a couple of words about how you work with the Leeds Institute of Data Analytics. Alistair, would you be best placed on that one?
I was just starting to tap a response, actually. I'll just read what I was going to say. So it's off the top of my head, I'm not sure what researchers have access to. So it's obviously very controlled. I know we work closely with LiDAR, so I can't answer off the top of my head, but we do, so LiDAR kicked off a Masters in Health Data Analytics, started in September in the joys of COVID, and there's eight students on there. I'm actually one of them, studying for the Masters. So we are working with the likes of Professor David Hogg and stuff, who chairs that course, and obviously I'm very involved in LiDAR, which has been really fun, actually. It's been fun and stretching, if I'm honest. Sort of plug into sort of the Leeds expertise around that. And I'm a Leeds resident of 9 years, and I didn't know how much expertise was sitting up there in the university, and the number of PhD students doing quite cool stuff with AI for clinical reasons, which has been a real eye opener. So I don't know what LiDAR have access to, but we do work with them, I guess is what I'm saying. Happy to follow up, Eric, if that's useful.
Thanks, Alistair. I'm sure that Eric will be seeking you out either on LinkedIn or through. There was a question from an attendee about us sharing the names in a bit more detail of speakers today, which we'll do with a wrap-up email afterwards. There was also a question about digital inclusion. This is really high on our agenda at the council as well. And Ros was asking around NHS Digital's role in this space. So I don't know whether Sarah or Nick would like to come in on that one.
Yeah, I mean, I guess, and Sarah, please chip in. I guess, we do a lot in terms of our service design, in terms of making our services as accessible as possible. Ros, I'm aware of that work, and I need to sort of check back with the team, and I think there may be opportunity to join up even more closely around that agenda. But Sarah or Jonathan, I don't know whether you've got anything further to add.
Yeah, actually, so we're very focused on it, and we spend quite a lot of time. We've got some specific programs with Good Things Foundation and others working on how we can extend inclusivity. But if there are specific parties in Leeds that we don't yet know about who would want to work more with us on that, that'd be great to know about them.
Thank you very much. And then I think we probably haven't got time to cover all the other questions in full, but we'll try and come back to some of those afterwards. There was just one question from Nigel Jones, which I should be able to answer very quickly, which was, what's the attitude to attracting more relevant and appropriate international digital companies to Leeds? So we work really hard as a council on promoting Leeds as a great location for people to visit, invest, live and stay. And we do that through a range of areas. We, on an international scale, we have an international relations team who manage ongoing relationships with sister cities, but we're also part of the Eurocities network. And we're doubling our commitment around that in terms of refreshing our memorandum of understandings with our sister cities this year in Europe. And we're actually currently doing a kind of specific piece of work to ensure that people understand that we're still open for business. And digital is one of the key themes in some of the work that we're looking to do with those sister cities and through the Eurocities network. So if you'd like to know any more about that, please do feel free to contact us at the council if you want to get involved or hear more. So I think, Nick, did you want to make any final remarks by way of wrapping up?
I think Sarah may just do a quick wrap up, but I just want to thank everyone, for their contribution and their support and working in partnership with us. But hand over to Sarah.
Yeah, I mean, I won't say much more than that because I realise we're out of time. It's just massive thank you for people joining us this morning. It's not quite the same joining virtually, is it? So what I would say is that we will buy you all a drink as soon as normal life returns and we can find a place to get together in Leeds and catch up in person. And until then, have fun and thanks for your partnership.